Okay, I'm Dr. Bramlett. This is a case we're doing today at Grandview Hospital. I'm going to explain the difference why we do unicondylar knee replacements. The reason that is, as we come look at this knee, this is a lateral compartment of a gentleman who's in his 60s. In his medial compartment, obviously this dark brown that you can see in the contrast, that's where the cartilage is gone. So it's like having a left front tire, which is shot, and a right front tire, which is totally normal. So you don't replace both tires, just one. So we're going to do a half knee replacement on his knee, and we'll show you that in just a moment. But this is why we do half knee replacements, which are easier to do, easier to recover from, and generally speaking, he's going to be done as an outpatient, go home today, and start driving a car in 2 or 3 days, which is exactly what he wants. So that's the unicondylar knee replacement and the reasoning why how we do it that way. Okay, so what we've done now, we've replaced what was the bad spot, which we indicated in the previous video. So now we've got, this is a cobalt chrome implant. This is a half knee replacement or a unit knee replacement. Polyethylene spacer. This is cemented tibial component, femoral component. They're in place. So we're going to remove the retractor here, put the kneecap back in its normal position, and that's the whole sliding motion. So the grinding condition that the patient had, that'll be eliminated. We're going to close this up like so. He's going to go home this afternoon. That's the unicondylar knee replacement, so you're understanding. Hope that's helpful. Thank you. So you are 2 hours after surgery. How you feeling?
I'm feeling great.
No problem?
No problems.
Okay, so I mean, you've had surgery. We know that. We got this wrap on you. Just bend your knee up, bub. Attaboy. Does that bother you much?
Nope.
Okay. All right, straighten your leg out. Hold it up tight.
Okay.
Good. All right, so yeah, you're just a cool customer. You're strong and motivated and you're doing well. So we're going to send you home, like we said. You had a half knee replacement, and you can take a look at it, send some information next couple of days, you know,
All right.
and go easy. You can walk with it without crutches.
Okay.
Make sure you got your balance.
All right.
If you need to use a walker or something for a day or two, that's okay. You're not losing anything by doing that. Just don't stumble around.
Okay.
And then elevate a couple times a day.
I will.
You know, elevate it up in the air.
Okay.
Use your ice on it, and this comes off Saturday morning, which is about 36 hours from now.
All right.
And you can re-wrap it with an ace after you take a shower.
All right.
Have a good day.
Well, you have a good one too. Thank you so much.
Okay.
Appreciate it.
All right, see you later. Okay, so what we're going to do this morning is just show the end result of a gentleman who we started viewing in surgery at Grandview a couple weeks ago. And what we're going to see is his knee replacement. He had a half knee replacement because of medial compartmental disease, which was clearly shown by the intraoperative video which we had recorded. And now we're going to show by flipping on to his x-ray, his knee, and we're going to show also his post-op activity. We shoot a video on Mr. H showing his medial compartmental disease on the right side before surgery. You can see that his lateral compartment was very, very wide. He had no pain in this area. So if you have medial compartmental disease with compression, which he has, and there's a very white sclerotic margin compared to the other side, which still has open wide space. So if you look at these in comparison, the right, where the pointer shows the medial compartmental disease. Classic presentation, and so he's gone from there, as we indicated, to there. Again, medial compartmental disease, which we've got two, totally. Now it's leg straight. So, 13 days post-op. Mr. H. Gotta keep your name square. So tell me about your experience now.
Well, it's been up and down. We've had a lot of swelling. We've worked it really hard. We've done all the exercises on a regular basis, 3 to 4 times a day. I try to walk quite a bit, and one day I think I walked too much. I walked a couple of miles, but after that, it gets better every day.
But you had what? We had, this is a
partial
knee replacement. Yeah.
Yes.
Okay. Take a seat.
Okay.
And let's see you move it. Straighten out. Yes, it. Good. And here's the incision. It's stitches under the skin. Okay, bend it back. Those black spots are just tape.
Oh, okay.
With hematoma, it's just blood that got mixed into the tape. Straighten it out again. That's going to come off with alcohol now that we've pulled your bandage off. Okay. Let's see you walk now.
Okay.
All right, it's pretty lickety split right there. Okay. 13 days from a unicondylar knee replacement. Yeah, good. All right, so what's your pain level now?
Pain level's probably 3 or 4 maybe.
Yeah. Okay. Good.
Nothing.
So your opinion of the process so far?
Well, it's been a challenge, but I think it's going to be worth it.
In what way?
Well, just because we're so active, love to hike, and we walk a lot and camp, and I love to hunt and fish, and
Yeah.
it requires a lot of bending and toting and lifting, and so it's something that I think I needed to
Yeah.
move on and have a
Well,
life.
where your X-rays look right on.
Okay, good.
I mean, you're a hard charger kind of guy, but I want people to understand it's not like you just poof and all of a sudden you're well. There's some work involved.
That's right. It's
You
right.
know?
You have to stay with it.
But you've done what we said do.
I have.
You're 13 days out. You're walking like you're almost running down the hall, you know, but that's the kind of guy you are. Not everybody's going to do quite this quick, but with the right understanding that you got to, quote, participate
You have to work at it.
and work out a little bit, then the rest of it comes in pretty easy.
We start early and end late. That's what we do.
There you go. All right, fantastic. Well, I appreciate you letting us
You bet.
show
It's
this.
my
Okay.
privilege. Thank you.
Okay.